Hi, I'm Dr. Michael Kohler, and the purpose of this training video is to show students all of the steps of the physical examination from start to finish so that you get some idea of how the steps flow one to the other and how to make a transition from one body system to another. We're not going to focus on the details of the steps during this examination or any close-ups, and if you feel like you need some reference to the details, I'd refer you back to the individual exam series for those details. This examination, of course, is on a male patient, so there'll be no axillary lymph nodes or no breast examination, and also we will not do a genital examination on this video. And I'd like to thank John, one of our standardized patients, for agreeing to be part of this training video. The steps, of course, can be in a different order. It's not critical that every one of the steps follow the order that you see in your outlines from class. But what is important is that all the steps are done. You do want to make sure that if you rearrange a step, that you try to minimize patient movement up and down and pay attention to patient comfort if you arrange the steps so that there is a flow for the patient and there's no unnecessary movement. And of course, before we begin any examination, we always wash our hands. So first I'm going to wash my hands. The first step of the examination would be to describe the patient's general appearance. And of course, you're not going to describe that to the patient, but throughout the history, you're going to be noting whether the patient looks at their apparent age, whether they're in any apparent pain or distress, and also whether their respiratory pattern is labored or is there any sign of distress. And John certainly appears his stated age. He doesn't appear to be in any discomfort. His hygiene is good, and there's no obvious signs of pain. So I'll just go ahead and move on. So the first thing I'm going to do is ask you to hold out your hands for me, John. I'm just going to take a look at your hands and your fingers here. Is there any pain or discomfort
No.
as I do that? How about these joints or knuckles or any pain?
No.
Then put your palms up. Okay, good. And put your wrists back down again. Any pain when I press on your wrist bones here?
No.
No? Good. And I'm just going to feel along your forearms there. Okay. I'm going to feel different parts of your elbow. Is there any pain or discomfort as I press on those bony prominences? No? I'm just going to press a little bit higher. There's sometimes some lymph nodes higher up in the arm, but again, I don't feel that. So you can rest your arms down. The next thing I want to do is to check some range of motion and muscle tone. So I'm going to ask you to kind of let your arm go loose and kind of floppy here. And move it back and forth. Good. Kind of bend your elbow back and forth. Then your wrist up and down. In and out, good. I come around the other side and do that over here too. Again, just kind of back and forth. Just relax your arm, good. Your wrist back and forth, good. Okay. Now I want to have you check for you doing the range of motion. Can you hold your wrists up, cock them up, then down, good. Then put your wrists in, then out, good. Spread your fingers out, and back in, make a fist, and make muscles and go straight out. Good. Now I want to test the strength in your upper extremities. So could you put your arms up like that, hold them real strong, don't let me push down. Good. And make muscles like that, pull in towards you, real strong, good. And push out against me. Good. I'm next going to have you hold your wrists up. I'm sorry, good. And then don't let me push them down, real strong, good. Now push down to my hands, okay. Push down, good. Actually grab my fingers, squeeze real hard. Good, okay. The thing I want to do is have your elbows at your side and check your wrists to go up and down. Good. Okay. All right, good. So that's pretty good for the upper extremities. Now I want to check the pulses in your wrists. So just kind of relax your arms. I'm going to count your pulse here by looking at my watch. Good, and your pulse is nice and regular, and I get it to be about 78, so that's normal. The next step I want to do, John, is to check your blood pressure. You want to make sure the cup is the right size. Just kind of lift this up a little bit. I'm just going to actually put your arm to the side. Good. I also want to check. Good. Okay, so this is the right size cuff. If we use the wrong size cuff, it'll falsely elevate your blood pressure. Just so I can get a rough idea of what your blood pressure is, I want to, I'm not going to use my stethoscope at first. I'm just going to pump up the cuff and get some idea when your pulse goes away so I know what the top number is here. Good. And I get it to be about 138, which is a little bit on the higher side. As we talked about in the history about your high blood pressure, we'll talk about that further after the examination is over with. Next, I'm going to go ahead and check your blood pressure. You just kind of let your arm stay loose and let me hold it up. Keep your elbow nice and straight there. Okay, good. I get 130/86. Now I'm going to check it in the other arm here. I can kind of bring this around the back. Good. I get 132/84. So there's always a little bit of difference between the arms, but that's an acceptable difference. Good. Next I want to just kind of examine your head. And you turn your head to the side there for me. Other way, good. I'm just going to touch different parts of your head and scalp. You tell me, is there any pain or discomfort as I do that?
No.
Good. You can turn your head this way. Just want to look a little closer look at your scalp here. See if there's any. And lunge your head forward. Good. And that way. Just checking to see if there's any scalp skin problems. And I don't see that. Good. Then I'm going to have you just look up towards the ceiling. I'm going to pull your eyelids down here. Good. Okay. And that looks fine. I'm going to check your vision, John. I'm going to have you, what I'm going to do is have you put one palm over your eye and hold this card in your other hand. And why don't you try to read that line for me there.
All right. It's 3, 7, 4, 2, 5, 8.
Good. Can you try the line below that?
9, 3, 7, 8, 2, 6.
Good. How about the line below that still?
4, 2, 8, 7, 3, 9.
Good. So you got all those answers right. So that's 20/20. Let's have you do it in the other hand. Palm over the other eye. Good.
For this
Try
one.
this line right there, yes.
9, 3, 7, 8, 2, 6.
Good. And the next line below it. Can't do that one?
4, 2, 6. I'm kind of good from memory.
Oh, then don't do it. So that'd be 20/25 in your left eye. Good. Okay. Next, I want to check what we call your peripheral vision. So I'm going to ask you to do, John, I'm going to ask you to stare right at my nose. I'm going to wiggle my fingers to one side or the other or both. I'm going to ask you just to point where you see that wiggle. So you can try just to stare at me and I stare at you and tell me which side you see wiggle. Okay?
That side.
Okay.
That side.
Good.
Both sides.
Good. Okay, I'm just going to move here now.
That side.
Good.
That side.
Good. And then now.
Both sides.
Good.
That side. That side.
Good. That's good. Your peripheral vision is fine. I'm going to check your pupil response to light. So I'm going to ask you, John, just to kind of stare straight across at the wall. Okay? Just shine the light at your eyes and see how your pupils constrict. Good. Good. And both pupils are working normally. The next thing I want to do is check how well your muscles in the eye move the eyes around. So I'm asking you just to look at my finger and just to keep your head straight. And just move your eyes to look over here. Good. Then look up. Look down. Look all the way across. Up. Down. Good. And then I'm going to have you look in. Good. That's all fine. Next part of the examination I want to do is to check the sensation on your face. And what I'm going to do, John, is just touch different parts of your face with this cotton tip. Maybe close your eyes, and when I touch, just tell me where I'm touching, okay?
Forehead,
Okay.
forehead, cheek, cheek, cheek,
Good.
chin, chin.
Good. Okay. You can go ahead and open your eyes. That was all fine. Then I'm going to have you do next is to wrinkle your forehead. Just kind of look up at the ceiling. Good. And show me your teeth real wide. Good. Okay. I want to check your hearing now, so I'm going to rub my fingers one side or the other. And if you close your eyes and point to me which side you hear the rub on. Okay?
That side. That side. Both sides.
Good. Okay. And can you turn your head to the left and just give me a cough? Good. Okay. You can look straight ahead now. I'm going to have you shrug your shoulders, so just lift up. Good. And turn your head that way against my hand. Good. Now push the other way. Good. Okay. And then stick your tongue out at me. Good. Okay. And most patients usually like that part of the examination.